1% of the world population that has a nickel allergy. And yet there's nothing on the market that exists today to try to prevent these reactions from happening. Nickel is almost impossible to avoid. It exists in belt buckles, jewelry, eyeglass frames, cell phones, doorknobs. It's all over the place. And so the challenge then is, how do you prevent these reactions from occurring? What happens now is that when a patient contacts nickel, who has this nickel allergy, they have a reaction that occurs. Then they'll go to their dermatologist, they'll get prescribed steroid cream, they'll apply the cream, and the reaction will subside. But this will happen over and over again, so it's very cyclical. So we were interested in trying to solve this problem. And so we developed a series of design criteria for an ideal solution. And we came up with an approach that utilized materials that were on a list called generally recognized as safe. So these are materials that the regulatory bodies look at, and as long as you use them topically, you don't need to go through 10 years of clinical trials to get them into the marketplace. But we found materials on that list that could bind nickel very strongly, and we could formulate this in the form of particles that could be applied in a cream. So when someone contacts nickel, the nickel binds to the particles on the skin and it can't get into the skin, so it prevents it from actually accessing the skin. And then you can rinse the particles away from the skin and remove all the particles and all the bound nickel. So we developed a solution that was based on calcium carbonate particles, and we also found calcium phosphate particles worked as well. These particles are small, so they have high surface area to volume ratio, but they're large enough that they can't get into the skin, so they just sit on the surface of the skin. So we published our paper in the Journal of Nature Nanotechnology, and this was picked up by many media outlets, including LA Times and CNN. In fact, CNN put it on their homepage, and there was a long list of people who wrote in asking when was this going to be available, and they were so desperate to have this. Again, it's 9% of the population that has this allergy. And so working with Jacques Delort, who's an experienced entrepreneur who had worked in the consumer space before, we launched a company called Skintifique. We've been able to formulate these creams into a product that can work on people. We've scaled the production of this material, bottled it, and it's now being sold on Amazon and a number of pharmacies in Europe and also in the US.